Hi, good afternoon, Mr. Collum. I'm Karen, your CNA. We're going to go ahead and get you fed. Before we get started, let me close the door for your privacy and get my hands washed. Could I get you to go ahead and sit on the side of the bed for me? And while you're sitting up, I'm going to go ahead and get your meal tray. First thing I want to do is I want to ensure the correct client, so ask the client to state their name. What's your name, sir?
Corey Collum.
Okay, awesome. Let me go ahead and place the tray on the bedside table, and you want to position the meal tray in front of the resident so that it's easily visible to the resident. Then go ahead and get a chair, bring it to the area, and get wipes, which will be located on the bedside table the day of the exam. What I'd like to do first is go ahead and wipe your hands. So if you could give me your hands, go ahead and wipe those off. All right, good. Well, it looks like today, Mr. Collum, that we have a green M&M and a yellow M&M. What would you like to eat first?
Green one.
Okay. Here is your green M&M. You do want to make sure that they've swallowed the food before you offer the next bite. So you can ask questions such as, was that good? Have you swallowed that?
Yes.
Okay. Would you now like the yellow M&M?
Yes.
Here is your yellow M&M. You must repeat what is on the spoon. The state requires that you offer one bite of each item and offer fluid one time. Would you like some water?
Yes.
Okay, let me help you with that. Okay, was that good?
Yes.
All right, once we've done 2 bites and 1 offer of fluid, let me go ahead and wipe your mouth off, and let me re-wipe your hands. All right, I'm now going to go ahead and put my hand wipes into the trash can, and I'm going to take the tray to the designated dirty area, which will be this chair on the day of the exam. I then will return to my client, ensure that they have the call light, there you go, and wash my hands. On feeding, the automatic failure is not ensuring that your client is at a 90-degree angle. The best way to accomplish that is have them sit up rather than just raising the head of the bed. That completes feeding a client. Hi, good afternoon, Mr. Collum. I'm Karen, your CNA, and I'm here to do some exercises on your knee and ankle. Before we get started, I'm going to close the door for privacy and I'm going to get my hands washed. If you're right-handed, it's easiest to work from the client's right side. What you need to tell the client is if you experience any pain during this exercise, you need to let me know and I will stop. While supporting the ankle joint and the knee, you're going to bend the leg 3 times. 1, 2, 3. Again, make sure you return it all the way to the bed. Then you're going to support the ankle with one hand and take your hand and take the foot, and we're going to go do 3 movements of the foot. I'm going to do plantar flexion and dorsiflexion once, down and back twice, down and back 3 times. All right, let me go ahead and give you your call light. Need anything, let me know. And I'm going to wash my hands. The automatic failure on range of motion in knee and ankle is also not moving gently and slowly through the process and not stopping if the resident says they're experiencing pain. That completes range of motion of one knee or ankle. Hi, good afternoon, Mr. Collum. I'm Karen, your CNA, and I'm here to do some exercises on your shoulder. Before we get started, let me close the door for privacy and get my hands washed. If you are right-handed, it's best to work on the right side of the resident. Okay, before we get started, if you experience any pain during this exercise, you need to let me know so that we can stop. While supporting the wrist and the elbow in a cupped fashion, we're going to move the arm 3 times upward. 1, 2, 3. Okay, make sure you go to the level of the ear. Now we're going to go out 3 times. 1, 2, 3. Always return the body part back to the side of the resident. Go ahead and ensure that they have their call light. and then indicate that you would wash your hands. The automatic failure on range of motion of shoulder is not supporting the limb and moving gently and slowly through the process and not stopping if the client experiences pain. That completes range of motion of a shoulder.